Hello. My name is Jones, and today we are going to look at child abuse and some of the signs that can be used to detect child abuse. Okay, so within this lesson, I'm going to provide guidance for people working in voluntary, community, and commercial organizations that have child protection policies in place on how they can recognize the signs of child abuse so that they can alert the appropriate authority. Please kindly note that this lesson does not constitute legal advice, but just there to help people within these voluntary organizations, nurses, and other people that deal with different forms of child abuse to know more about the types of child abuse and some of the signs to detect child abuse. Abuse and neglect are forms of maltreatment of a child. Somebody may abuse or neglect a child either directly or by inflicting harm or indirectly by failing to act to prevent harm. Children may be abused in a family or in an institution or community setting. This is mostly done by those known to these children, and most rarely, I would say, it is done by a stranger. They may be abused by an adult or may be abused by adults, or they can be abused by fellow children or by a fellow child. There are basically 5 types of child abuse that necessarily we are going to discuss within this lesson. So the 5 types of child abuse that we are going to look at include physical abuse, emotional abuse, sexual abuse, neglect, and bullying. So those are the types of child abuse necessarily that we are going to look at. So starting with physical abuse. Physical abuse may involve hitting, shaking, throwing, or poisoning, or banning, or scolding of a child. And by UN definition, a child is any person who is 16 years and below. So in physical abuse, we are saying if you hit the child or vigorously shake the child, or throw the child, poison, or ban this child, then it may constitute some form of physical abuse. Okay, so other forms of physical abuse may include drowning, suffocating, or otherwise causing physical harm to child, or failing to protect a child from that harm. Physical harm may also be caused when a parent or caretaker fabricates the symptoms of or deliberately induces illness in a child. Okay, so that is on physical abuse. Let us now look at emotional abuse. Emotional abuse is the persistent emotional maltreatment of a child such as cause severe and persistent adverse effect on the child's emotional development. It may involve conveying to children that they are worthless or unloved, inadequate, or less valued. Okay, so they may meet needs of another person and the likes. So hence, emotionally, they will be traumatized. So it may feature age or developmentally inappropriate expectation being imposed on children that may cause this same as emotional abuse. So these may include interactions that are beyond the child's developmental capability, as well as overprotection and limitation of exploration and learning, or preventing the child participating in normal social interaction. It may involve seeing or hearing the ill treatment of another child. So it may also involve a serious bullying, causing children frequently to feel frightened or in danger, or the exploitation or corruption of children, hence emotionally being traumatized and causing emotional abuse. Some level of emotional abuse is involved in all types of maltreatment of a child, though it may occur necessarily alone. So emotional abuse, necessarily we are looking at persistent emotional maltreatment of the child. That may cause severe or persistent adverse effects on the child's emotional development. Then another type of abuse that we can talk about, child abuse, is sexual abuse. It involves forcing or enticing a child or young person to take part in sexual activities, including prostitution, whether or not the child is aware of what is happening. So this constitutes a form of sexual abuse. So sexual abuse is necessarily forcing or enticing a child in sexual activities. So the activities may involve physical contact, including both penetrative or non-penetrative acts, such as kissing, touching, or fondling the child's genitals or breast, vagina, or anal intercourse, or oral sex. So all these may constitute sexual abuse. They may also include non-contact activities such as involving children in looking at or in the production of pornography material, or watching sexual activities, or encouraging children to behave in a sexually inappropriate ways. So this necessarily will constitute sexual abuse. So when you're talking about sexual abuse, involves forcing or enticing a child or young person to take part in a sexual activity that may include prostitution and other things, and all these other items that necessarily we have highlighted. Okay, so now let us look at another type of abuse, which is neglect. Neglect is a persistent failure to meet a child's basic physical or psychological needs. This will likely result in a serious impairment of child's health or development. Neglect may occur during pregnancy as a result of maternal substance abuse. So once a child is born, neglect may involve a parent or the caregiver failing to provide adequate food or clothing, shelter, including exclusion from home or abandonment. Failing to protect a child from physical and emotional harm or danger also constitutes neglect. Also, failure to ensure adequate supervision, including the use of inadequate caretakers, may also constitute neglect. Or we can also look at failure to ensure access to appropriate medical care or treatment. So this may also be looked at as neglect. It may also include unresponsiveness to a child's basic emotional needs. So neglect is necessarily persistent failure to meet the child's basic physical and psychological needs. Okay, so let's look at another form of child abuse, okay, which is bullying, okay. We've included bullying as also part of child abuse because when bullying is necessarily defined as deliberate, hateful behavior, usually repeated over a period of time where it is difficult for those bullied to defend themselves. So that is how bullying is necessarily defined. When we were defining child abuse, we were saying it can be done by adults, okay, it can be done by children, okay. So bullying mostly is done by fellow children, okay, to the child, but it can also be done by adults. So bullying, deliberate hateful behavior that is repeated over a period of time and affects the child's development, interaction, and the likes. So it can take many forms, but the three main types are physical, that is hitting, kicking, or necessarily theft. Then there is also verbal bullying. Apart from physical, there's verbal. These include racist slurs or racist talk, or it can be homophobic remarks, threats, or name calling. Then there is emotional bullying. Emotional bullying may include isolating an individual from the activities and social acceptance of their peer group. Okay, so these are the main types of bullying. That is physical, necessarily where you physically hit someone or kick, then verbal, it has to do with the language, which is intimidating, then emotional, isolating an individual from the activities, okay, or acceptance of within their peer group. So the damage inflicted by bullying can frequently be underestimated. It can cause considerable distress to children to the extent that it affects their health and development. At the extreme, can also cause them to start exhibiting mental health problem, or it may lead children to harm themselves. So all settings in which children are provided with services or are living away from home should have in place rigorous enforced anti-bullying strategies. Okay, so for those that are running schools for children, please, you need to take care of bullying issue, because there are some children that have stopped going to school because of bullying. They might not necessarily tell their parents that there's bullying because they fear if the parents necessarily doesn't follow up this nicely, they may continue being bullied. So bullying is one of those serious forms of child abuse. Okay, now that we have appreciated the types of child abuse, let us now look at some of the signs of abuse. Recognizing child abuse is not necessarily easy, and it is the responsibility of parents, caretakers, and those involved in taking care of children to necessarily look at some of the risk that this may involve. Okay, so you need to know that as a caretaker, you do not necessarily have the responsibility and duty to set out within your organization, okay, necessarily what necessarily bullying necessarily is there. But it is important that you bring it forward or act upon it so that appropriate agencies can investigate and take necessary action to protect the child. Okay, so when take children to boarding schools, this time people are taking children to boarding schools as young as 6 months. You are taking the child to baby class or whatever, kindergarten class. You're taking the child to school at 2 years, and then they are bullied from there, and then necessarily what happens, they will hate school. Okay, they'll start having certain bruises unexplained. They say, oh, it was an accident, oh, it was ABC. So all these things can necessarily be looked at. But otherwise, under physical abuse, there are many signs that can necessarily be elicited to identify physical abuse. So most children will collect cuts and bruises as part of the rough and tumble of daily life. Injuries should always be interpreted in light of the child's medical and social history, developmental stage, and the explanation that has been given. Most accidental bruises are seen over bony parts of the body, for example, the elbows, knees, and are also often seen on the flank of the body. Some children, however, will have bruises that is more than likely inflicted, but rather accidental. So important indicators of physical abuse are bruises or injuries that are either unexplained or inconsistent with the explanation that has been given. Okay, they may be visible on the soft parts of the body where accidental injuries are necessarily unlikely. Okay, so instead of seeing the injuries on elbow, knees, or chins, you start seeing injuries on the cheeks, abdomen, back, and buttocks. So these can necessarily be injuries coming from physical abuse. So a delay in seeking medical treatment when it is obviously necessary, it may also cause a concern. Although this can be more complicated with burns, as these are often delayed in presentation due to bristling taking place or taking a later time to show that there are these bruises. So the normal wounds that a child may sadly have because of accident is in bone prominences. But to do with physical abuse, we might see it in non-bone prominences. And the examples we have given is cheeks, abdomen, and buttocks. Okay, so some of the physical signs of abuse may include unexplained bruising or marks or injuries on any part of the body. And then we can also see multiple bruises in clusters, often on the upper arm, outside of the thigh, and the legs. Other physical abuse signs may include burns from cigarette. See signs as if the child was being tortured with a cigarette. Okay, you can see human bite marks on the child. Okay, they can even sustain broken bones. Okay, or they may have multiple burns with clearly demarcated edges. Maybe they use the pressing iron and the likes. Okay. What are some of the changes in behavior that can also indicate physical abuse? Okay, so on this one, there can be fear of parents being approached for an explanation. So this child may fear the parents because they feel that the person that is physically abusing them will continue even more when they explain. Okay, the child necessarily doesn't know who to open up with. So aggressive behavior or severe temper outbursts may also be some of the signs that may indicate that the child is having some physical abuse. Other indicators to do with behavior include flinching when approached or touched. Okay, the child is somehow scared, so they are in the scared mode even when you just give necessarily home touch. There can be reluctance to get changed. For example, in what weather you want to change the child's clothing and the likes, then they are reluctant because they don't want you to see those marks that have been created. The child may look depressed, withdrawn, and may start running away from home. So these are some of the changes in behavior that can be a sign of the child having some physical abuse necessarily at home. Okay, so now with that discussed, let us now look at emotional abuse. Emotional abuse indicators or signs may include a lot of things from neurotic behavior, being unable to play, and fear of making mistakes. But it is important that you know that emotional abuse can be difficult to measure as there are often no outward physical signs. There may be a developmental delay due to failure to thrive and grow, although this will usually only be evident if the child puts on weight in other circumstances. For example, when hospitalized or away from their parents' care. Even so, children who appear well cared for may nevertheless be emotionally abused by being taunted, put down, or belittled. They may receive little or no love, affection, or attention from their parents or carers. Emotional abuse can also take the form of children not being allowed to mix or play with the other children. Okay, so for this part, necessarily what I can advise is that we learn from mistakes, and parents try by all means to safeguard their children so that they don't make certain mistakes. The children will play with anyone. So as they are playing with some of these of their children, they will learn about those negative things, and then they will start avoiding to play with those children they feel they are abusive. So children who learn from mistakes. Okay, so mistakes necessarily are lessons of life. So emotional abuse, here we are saying don't refuse a child to play with any person that you feel comfortable with within the environment, and necessarily where you can protect. Of course, that protection of who they play with needs to come in. What are some of the changes in behavior which can indicate emotional abuse? So the changes in behavior may include neurotic behavior, okay, like hair twisting or rocking. It may include a fear of making mistakes, sudden speech disorders, self-harm, fear of parents being approached regarding their behaviors, or developmental delay in terms of emotional progress. So these are some of the changes in behavior that may indicate emotional abuse. Please remember that some of these things can be seen also in children that have not been emotionally abused. But if it all seems obvious that they have a lot of these signs, then it is important to have the matter tabled with people that can provide counseling in order to reduce the emotional abuse within the child. Then some of the signs necessarily that can indicate sexual abuse can be vast, from abdominal pains, the issue of pregnancy coming up in a child, or sexually transmitted diseases. So adults who use children to meet their own sexual needs abuse both girls and boys of all ages, including infants and toddlers. Usually in cases of sexual abuse, it is the child's behavior that may cause you to become concerned. Although physical signs can also be present, okay, so that is, physical signs can also be present within this sexual abuse. In all cases, children who tell about sexual abuse do so because they want it to be stopped. It is important, therefore, that they are listened to and taken seriously. So there are also physical signs that can be seen in children that are being sexually abused. So some of these signs may include pain or itching in the genital area, bruising or bleeding near genital area, sexually transmitted diseases, vaginal discharge or infection, abdominal pains, discomfort when walking or sitting down, and most likely the issue of pregnancy can be seen if the child has reached the puberty stage. Okay, so other changes in behavior which can also indicate sexual abuse includes sudden or unexplained changes in behavior, that is becoming aggressive or withdrawn, fear of being left with a specific person or group of people, having nightmares, running away from home, or necessarily the child may show sexual knowledge which is beyond their age or developmental level. Other signs of sexual abuse may include sexual drawings or language, bedwetting, eating problems such as overeating or anorexia. And other signs and symptoms may include substance or drug abuse, or the child suddenly having unexplained sources of money, or not allowed to have friends, particularly in adolescence, or acting in a sexually explicit way towards adults. Okay, then under neglect, there are also other signs that can be seen to show that there is abuse. Neglect can be a difficult form of abuse to recognize, yet it has some most lasting and damaging effect on children. The physical signs of neglect may include constant hunger, sometimes stealing food from other children, or it may be constantly dirty, or the child is smelling. There can be loss of weight or being constantly underweight, or it can be inappropriate clothing for children. Some of the changes in behavior which can also indicate neglect may include a complaint from the child that they are tired all the time, or not requesting medical assistance, or failure to attend to appointments. Other signs of neglect may include having few friends, or mentioning being left alone or unsupervised. So this is necessarily seen in children who have been neglected. Okay, then for bullying, necessarily as one of forms of child abuse. Here, some of the signs that can be seen is that bullying is not always easy to recognize, as it can take a number of forms. A child may encounter bullying attacks that are physical, verbal, or emotional. So for physical, pushing, kicking, hitting, it's important to see all the signs of physical abuse within the child. For verbal, that is name calling, sarcasm, spreading rumors, and the likes, you might see the child being withdrawn or showing signs of emotional abuse. Okay, then for emotional, including sending or that is tormenting or ridiculing or humiliating the child necessarily may become withdrawn. But otherwise, persistent bullying, the results that can be seen in terms of signs may be depression, low self-esteem, shyness, poor academic achievement, isolation, threatened or attempted suicide. Okay, so it is important that we note all these things because this time we are having children as young as 9 years committing suicide, as young as 6 years committing suicide, because people out there or caretakers out there, they don't note these signs of abuse in children. So the child may end up being frustrated and not seeing a solution to their problem. So some of the signs of bullying that may be seen that the child is bullying may be coming home with cuts and bruises. They may come home with torn clothes or buttons. And for buttons here, I will really make a lot of emphasis. When you see a child, most of the time, he comes with buttons removed from their shirts, buttons moved from their shirts. It's likely there's a bully who's pulling them on their shirts and these buttons are falling. So it's better you follow up the matter and see that your child is not bullying or that child is not being bullied. So asking for stolen possessions to be replaced or losing dinner, money, can also be a sign of bullying. We have children that go to school. Every time they come back from school, they are complaining of hunger, yet you packed food for them. It's likely there is a bully who is taking food from them and they are eating the food. And then this child stays without eating. Bullying also takes in the form where the child is eating and then another person without proper permission comes to eat with this child. And the child feels, oh, I'll be more safe if I allow this person to eat. Then at the end, the child is not satisfied. The bully gets the bigger share. So being moody and bad-tempered can be a sign of bullying in children or children that are being bullied. Wanting to avoid leaving their home or wanting to just be at home, not going to school, can be also a sign to pick. The child was interested in school and all of a sudden they are no longer interested going to school. It's important as a parent or caretaker to find out more as to what is necessarily causing this. So doing less or well at school also can be one of those signs as to maybe the child being bullied or feeling emotionally abused. So children who have been bullied also have sleep problems, they have also anxiety issues, and most of the time they become quiet and withdrawn. Okay, so with all these signs of bullying that we have discussed and the types of bullying that we have discussed, we can say the definitions and indicators that we have discussed within this are not definitive, but only can serve as a guide to assist you as a person taking care of children so that you can know those children that have been abused. It is important too to note that and remember that many children may exhibit some of these indicators at some time, and the presence of one or more should be taken as proof that abuse is occurring within this child. There may be other reasons for changes in behavior, such as birth of a new baby in the family or relationship problems between parents and carers. Okay, so in assessing whether indicators are related to abuse or not, the authorities will always want to understand them in relation to the child's development and extent. You know, when there is a child who has been born in the family, parents necessarily tend to give less attention to other children. So the other child now will start to feel withdrawn and feel neglected. So parents need to be aware that when there's a new child, such things can happen, so that they give the necessary care that they have been giving to the child, so that the child does not feel neglected. So there you have it. Today we have been looking at child abuse. We have looked at types of child abuse and some of the indicators of the child who's been abused under different types of child abuse. So from me, I'm saying keep studying.